Hi, I'm Dr. Michael Bohan. I am one of the orthopedic surgeons with Carolina Orthopaedics. I specialize in hip and knee replacement surgery. In this video, I'd like to talk to you about total hip replacement. Most times a hip replacement is performed for arthritis. Arthritis is a term we hear all the time, but many people don't really know what it means. Arthritis of the hip is a condition where the cartilage on the ball and socket of the hip joint is destroyed over time. This can happen from an injury or just wear and tear over the years. When this cushioning wears down, the underlying bone is exposed. You see, when bone rubs against bone, this causes pain, swelling, and stiffness. If you're sitting for long periods of time, you might find that when you get up, your hip is stiff. But usually, once you get moving, you might feel a little better. If your pain is causing a disruption of your life, and you've tried everything to help with the pain, such as medicines, physical therapy, and injections, and nothing has worked, you should consider hip replacement surgery. Nearly 500,000 total hip replacements are performed in the U.S. every year. Over the last decade, many advances have been made in joint implants and surgical techniques, making the surgery to replace your hip easier for you. If you need a hip replacement, you'll either be an outpatient, or we may need you to stay overnight at the hospital, where we have our own orthopedic floor. After your surgery, you'll begin physical therapy within about 1 to 2 hours. Once you go home, you'll continue to walk and do some home exercises as instructed by the physical therapist. Your hip will have a waterproof bandage, so you can also shower the day after surgery. Physical therapy will continue for about 6 weeks. I permit most people to start driving around 2 to 3 weeks after surgery. Golf and most sporting activities can resume around 6 weeks. Within about 3 months, your hip will feel good again. However, for some people, it can take a year before they are fully recovered. And the great news is, patients forget they have an artificial hip over time. It just becomes part of you. You'll be coming back to the office to see me, or my physician's assistant, periodically during the first year after surgery, and then every few years after. Of course, if you have any problems between visits, you are encouraged to call us. Thank you for your attention, and we look forward to taking care of you.